Super. I'll start first. My name is Dr. Dareen Siri. I'm an allergist immunologist. We have offices in Springfield, Bloomington-Normal, and a bunch of satellites. Taylorville starting up soon, but also Carlinville, Illinois, Sherman, Illinois, Morton, Illinois, and Jacksonville, Illinois. We mostly do specialty allergy, asthma, immunology. We do a little bit of internal medicine, and I'm going to introduce you to Tamara Reeter, one of our fantastic nurse practitioners.
Thank you. Thank you. So my name is Tamara Reeter, and I am a nurse practitioner mostly in the Springfield office. However, I do go to Carlinville and Jacksonville. Yeah, we do satellites a couple days a week, and it's nice. We're able to reach our patients that are a little bit farther away.
Fantastic. So I was wondering if we could start by talking about what you guys are seeing this year in terms of the allergy season, when it started and that kind of thing.
Tammy, you want to take that one?
Oh, sure. It's definitely in full force right now. We're starting to see more people coming in with the common symptoms, you know, the runny nose, the coughing, just increased congestion. And it's nice we are able to see patients in office as well as telehealth and do visits by video and phone. So we're able to help treat some of those symptoms that are emerging right now.
When does the allergy season usually begin? Is it around the same time every year? When did it start this year? And then how did that compare to last year?
The allergy season typically begins, if you're talking about seasonal allergies, and pollen typically begins when trees start to bud and release their pollen. So this is right about the time. It can start as early as March, though there are some years where it's been so warm that it started in February. Mold, when it starts to rain, comes up. And so we consider that, although it is a seasonal allergen, it is also a year-round allergen. And mold comes up whenever there's wetness and moisture. So pretty much when the ground begins to thaw is when you start seeing allergy type symptoms. And as they say, April showers bring May flowers. Well, this is the truth. Unfortunately, it also brings a lot of pollen. And so we have the problem with huge, big, chunky pollen that hits our eyes and our noses at this time of year. In addition to all of the spoils outside, the rotting and the mold and things like that, and the rainstorms and things like that, bringing up a lot of mold and pollen. Windy days, which are terrible. So right now is the prime time for allergies to be quite bad, but yeah, it varies from year to year. And when we have a super cold winter, stuff grows really vigorously in the spring, and so it can be quite difficult. And especially if we have a short spring season, because it goes from cold to warm very quickly and then it gets hot, then the trees have a very short time period to get all their pollen out, and so it can be more severe, because instead of having trees pollinate throughout spring over 3-4 months, they all pollinate together.
Wow. So in terms of this year and what we're seeing weather-wise, how does that kind of compare to last year?
What do you think, Tammy? I think it's probably on par. What do you think?
I think it's about the same. Yep.
Yeah, it's just that, in our offices, we've been seeing a slower traffic just because people are quarantined and suffering silently at home. And we've screened a lot of patients, she and I, patients who think they're having COVID symptoms, but they're not having fever. And actually, it ended up being allergy symptoms. And it's miserable because, yeah, it's really confusing for people. Even when they're having breathing problems, they're like, is this my asthma? Is this COVID? And then they can't smell. And that's a very common thing when your nose is stuffy. And they're like, is this COVID? So it's been difficult, and people haven't been able to just get in, but we can counsel them by phone, so that's easy. Yeah.
That was actually one of my questions, was how symptoms of COVID compared to symptoms of allergies, because I saw a lot of the symptoms like fever, cough, shortness of breath. I don't know if you get necessarily shortness of breath with allergies, but it is difficult to breathe, I think. So just in terms of how many patients would you say that you've had that have questioned?
Yeah, I think that the amount of patients is quite low, just because the penetrance of COVID-19 in our area is low compared to, Chicago or New York City. So the majority of people end up having allergy asthma rather than actually COVID. We've had some patients and healthcare workers actually be tested, and almost everybody's come back negative. So that's been great. So this time of year in our area, if you haven't been exposed to anybody knowingly with COVID, good bets are on allergy and asthma, just because it's up to 40% of our population. And, as allergists, we have a tendency to follow those patients because they have them. But certainly when we talk about allergies, we talk about the whole airway, the upper airway and the lower airway. So we call it allergic disease, but it's allergic asthma as well. And people can have seasonal asthma, so they can feel short of breath and have coughing and wheezing either from mucus draining or because they've developed asthma new. So do you want to go over some of the differences in symptoms, Tammy, between having this is a virus and infection versus I have allergies?
Sure, they are very similar, but it definitely, like you were talking about, it definitely depends on their history. Usually the people have it every year around the exact same time. Another thing is the exposure, depending on where you work, how much you're getting out, things like that. The other difference is with COVID, the fever tends to be a little bit higher too. And so it's just kind of going through the history and making sure that it aligns with their previous past. And then, of course, if they need to be screened, we will screen them for COVID as well. But generally, the symptoms are pretty typical from last year. And also, they tend to be just more allergic people in general. So they typically have asthma and eczema and things like that go with the allergic rhinitis. So just taking an overall full history is good. Anything that you want to add?
I would say that, if they have itch, that's usually an allergy symptom. Itchy eyes, itchy nose. It's typically not, I have a virus or flu. Fevers over 100 typically also are infections and not allergies. So those are kind of two good signs. And of course, colored mucus. Most mucus from allergies, it's running like water is what we say. So usually it's not thick or colored and things like that. Those are the things inform us that there may be an infection involved.
How closely related are, my family has a long history of allergies, and I always get sinus infections, and then bronchitis, and a lot of my family members get bronchitis really easily. So how tied are some of those viral infections, I guess, to allergies and seasonal allergies?
Yeah, there's a lot of association between people who have uncontrolled allergies and asthma-like symptoms and having more infection. So once you control it, people actually have less infection. And there's a variety of factors that contribute to that. One is that there's a lot of mucus that's being flowing. There are places that are getting clogged up, like the sinuses are getting clogged, the mucus gets retained, same in the lungs. So those are rich environments for bacteria and viruses to kind of set up shop and have a home, have them be stickier. And certainly people are touching their noses more. Things like that. They're rubbing and touching. The average person touches their face about 50 times a day, 30 to 50 times a day. And so someone with allergies may touch it more because they're blowing and touching and rubbing. And so in those cases, typically people with allergies and asthma type symptoms have more infections than others. But once it's controlled and they are rinsing, they're using their medications, decreasing the inflammation, maybe on a desensitization therapy like allergy shots or allergy drops, then actually most of our patients stay fairly healthy and well. And again, that could be in part because they're touching less. It could be in part because they're rinsing out viruses along with rinsing out the pollen when we ask them to do sinus rinses. And certainly the medications which help decrease inflammation also helps. Yeah. What would you say, Tammy? Anything you want to add to that?
Definitely. I definitely agree. Usually when people have really good control of their allergy symptoms, I mean, they're in our office less because they're less sick. So that's a good thing, right? Prevention.
So if people have allergies or seasonal allergies and they know certain things can cause the allergy season to be worse or less, how do you recommend them to control their allergies? Is it like a year-long process, or is it just taking a box of Claritin as needed?
Sure. So it kind of depends on the person and looking at their history, how many months out of the year that they're affected by their allergies, how significant their disease is. But depending on history, we do several different treatments, one being some of the medications that you discussed, the other being allergy shots. And allergy shots are a long-term solution, and hopefully that we can desensitize them to some of their allergens and making spring and fall a little bit more manageable to them, so they have to take less medication. So that's our goal.
Yeah, so the medications that you mentioned are over the counter. There are a lot of good options for over the counter. But as we talked about, as Tammy mentioned, those are medications. They suppress your symptoms, but they don't cure the problem. They don't fix it. They're just something that makes you feel better temporarily. So the long-term approach is to desensitize, which is allergy drops, which we do. It's innovative in Central Illinois. Really no one else in Central Illinois does them from an allergist, immunologist perspective at the strengths we use. And allergy shots, which also desensitize. So those try to change your immune system over time and make you less allergic. But medications are part of that, three-pronged approach as well, which is suppressing the symptoms so that you can get to work and do the things you need to do. And then lastly, of course, we control the environment as much as possible. So that's part of the three-pronged approach in which if you're allergic to something, you really should try to minimize it, cover it, wash it, close your windows, remove it if you can. I know some people just love their pets, but you can wash them. You can control that environment too. Yeah.
I don't really know how it's tracked, and I tried to find like a pollen tracker, but I wasn't sure. But how do you guys look at what areas of the state are going to be maybe hit harder by seasonal allergies?
So there's actually two forms of pollen recognition out there. There's actually pollen counting. So we do pollen counting at our office strictly for research. It's not widely available. I guess we could publish information, but it's very time consuming. So we actually collect pollen on these, they're almost like little stickers that go in a rotating deposition machine. And then someone manually has to count the pollen. Okay. So that's pollen counting. And that's a day-by-day basis. So then in which case people have to recognize that the pollen that's been counted has been the pollen that's been collected in the last 24 hours. So then you can predict, hey, if it's the same weather today as it was yesterday, pollen counts are probably going to be the same. So the other way of pollen counting is called pollen forecasting. So that's proprietary software. One of the companies out there called Pollen.com, they actually use a forecasting pollen counting method. So they actually don't real life count pollen. They basically have used patterns of pollen counting from previous years to forecast what it is for the time and the temperature and things like that. So again, there's issues with accuracy all around, but that's the best we have right now. There are some people who are trying to develop and put out their real-time pollen counting, which I love the idea. It's like crowdsourced pollen counting. Like you have all these people who have their little machines that they buy for $5,000 sitting in their, weather station or whatever that people have at home. And then they are live reporting it wherever they are. And of course, it's unfortunately not that many places that have that right now, but that would be an amazing tool for something like that to exist. It's difficult because there's so many types of pollen. They're complex. It's really difficult to actually recognize the different types of trees and grasses. So many times when you hear about pollen on the news, usually they've gotten it from pollen.com. It's usually not super local. Like there's no pollen counting station here in Bloomington-Normal, Springfield, Central Illinois, Peoria, etc. Unless of course it's research, us, doing it. So the pollen information they're getting is either from Chicago or St. Louis. And as you know, in our area, we have microclimate, so it can be different. But generally, it's not bad.
Okay. Yeah, see, that's why I was running into. I saw that there was a counter in Chicago and one in St. Louis, and I was like, but what about the rest of Illinois? So
yeah. And those guys in Chicago and St. Louis, they don't count every day. They might count several times a week. Yeah. Mm-hmm.
What do you guys use your pollen counter data for, if it's just for research?
Yes, so we have several studies where we're helping to develop different allergy medications. So for example, they have these tablets that are immunotherapy, so desensitization tablets. We're talking about a long-term solution that are available now. So you can pop like a grass tablet or a dust mite tablet under your tongue. And then that desensitizes you very similarly to the drops or the shots that we do. And we help develop that for some pharmaceutical companies. And so they require pollen counting to make sure that actually that pollen was in the air when we were actually using the medication on the patients. So yeah, so that's what we use those for.
That's interesting. It sounds like really complicated.
Actually pretty cool.
So how does I guess maybe we've talked about this, but what causes seasonal allergies to be worse or not as bad year to year?
You want to take that one, Tammy?
Sure, sure. Like you were mentioning earlier, when it's really, really cold, and then we kind of skip the spring season. And so then you have a relatively short spring. All of the trees are blooming at one time versus it being spread out. Then you're just going to have a more concentration of that pollen count that we were discussing earlier. As well as some people are allergic to molds. And so whenever it's rainy, it's damp outside, then you will have a higher allergen response then as well. So it kind of depends on what you're allergic to as to when it's going to be worse for you. Also, ragweed is a really common allergen, and it typically stays in the air all year round. And so it's really good to know what your allergens are. And so we do a lot of skin testing in our office, so we can find that out for patients. So then we can give them a little bit of an estimate of, hey, this is going to be your peak season. This is when you really have to watch out for your allergies, and we should do an aggressive treatment during this time so we can get you a little bit more control.
Okay. In terms of what we're seeing this year with this year's weather pattern, how would you say what people can expect?
So, as you hear from the forecast, it's going to be like 30 degrees in a few days. We're taking our plants outside, we're bringing our plants inside. They're going on. Yeah, that really does a number on people with a lot of sinus congestion, sinus pressure. They're getting barometric pressure changes. They feel it in their sinuses. And then, yeah, it's making the trees a bit confused. So then they release pollen and they slow down. They release pollen. And so this is definitely going to be a bad season. There's a lot of dampness, a lot of wetness. And, it's person to person, really. Whatever the pollen season is, it's always individualized. The treatment that we give is 100% focused on you and your symptoms. So if you have more information, you come in, you get tested, we can predict for you when you need medication, when those symptoms are probably going to be infection versus allergies, because you're not allergic to something that season. And even though the pollen's not that high, that one individual person may have really bad symptoms. And so just because the pollen counts aren't high, it doesn't mean that person isn't suffering as much as someone else. There is a concept called priming, which means that when the allergy season begins, like everything goes crazy. So then you feel like everything is hyped up. Your sinuses are bothering you, your skin is itchy, your scalp is itchy, and then these things didn't necessarily bother you before, but now because the allergy chemicals are floating around, that even if you're allergic to a couple of trees, you can feel like everything's bothering you. And so we also see that in food allergies, where some people are so allergic that some of the pollen that are similar to some of the foods we eat in raw fruits and vegetables, people are getting itchy mouths and mouth sores, and they feel like those foods bother them too. So that's part of the allergy priming. So person to person, we have a tendency to see the more severe patients in our office, moderate to severe patients, because most people with mild allergies who just take a Claritin, they're fine, probably don't need to see us unless they want to know what they're allergic to or want a long-term relief. And so so we see a lot of these even severe allergies in a lot of different patients.
Yeah, so I guess that kind of leads me to my next question, which was, what are you guys doing right now in terms of seeing patients? I know we talked a little bit before our meeting started about working from home and telehealth, so I was wondering if we could go a little bit over that.
I think Tammy's been like an amazing, compliance officer at our office. So you take it away, Tammy.
So we are doing both, actually. We are seeing patients in office as well as doing telehealth. The nice thing about that is that we are able to reach our patients that can't get out, whether they have an immunodeficiency or high risk, or we can see them in office. And the nice thing about that, since we are seeing less patients, we can spread the appointments out. And so there's less people in the office at a time. And so then it reduces the risk as well with everything going on. So we're doing both. We accommodate pretty much anybody. We are available. Dr. Siri is available a lot of hours a day to reach out for our patients that need us. And so both telehealth and the office.
I think it's been really convenient for patients. We have a lot of patients, we live in a rural area, so people have traveled, 2, 3, 4 hours. We have patients coming from, Iowa, Chicago, Indiana, Missouri sometimes. And so it's been really great for them to be able to just hop on the phone and we can touch bases about their problems. Technology has been really an aid. We send their labs to their local hospital to get labs drawn. We've done a lot of things at home and have been kind of innovative about care. I've had some patients, test themselves with some of the things they have at home, and then we watch them and talk them through it. There are, you know, at home like asthma monitors that we can do. Even in the office, you know, we've implemented a lot of strategies really early on that helped us keep ahead of the game. You know, restricting the amount of patients in office, social distancing, even in the break room, you know, wearing masks in the office, reducing the amount of like blowing and spirometry. We give allergy shots outside when the weather's good, you know, and give patients the option of waiting in their car, a lot of aggressive screening before patients come in. So it's kept, you know, not only our patients safe, but also our staff safe. And I think you want to be reassured that whatever environment you go to, that, you know, that you're not going to catch something else. So I think this has been a good thing for healthcare in general, in terms of just the precautions. Obviously, not a good thing that we have COVID and that, you know, it exists for us to treat. And there have been a lot of, you know, cases of patients getting healthier and better because of the aggressive things that have been implemented around the country. So I think it's been a good thing that the medical community has gotten together in these large ways. And so even though we feel distance, I think we are together more closer as a community in terms of, you know, helping patients. And those patients who, are vulnerable, who have immune problems, who really can't afford to catch anything, are able to get care safely at home. And we're available to them. If we feel like they need to come in the office, we say, come on in, you know, and then we do our best to keep them safe. So at least they know they don't have to run to a prompt care or a hospital where it might be a less safe environment for them. So, you know, we've been committed to keeping our doors open, which I think has been great. So thank you, Tammy.
Yeah. Thank you. Great.
How many patients would you say that you see are immunocompromised? Does that have anything to do with having allergies in general? Is that usually hand in hand?
We see the whole spectrum of immune problems. And so some people have a hyper response to things outside or inside. So we call those allergies. If you have a hyper response to your own body, that's called autoimmunity or autoimmune diseases like lupus, rheumatoid arthritis. And then if you have a weak immune system, you're easily susceptible to infections, that's called immune deficiency. And so we touch bases as allergists. We're also board certified in immunology. And so we take care of those patients as well. And we have a lot of immune patients that we see. Yeah, for sure.
And then circling back, I know we talked a little bit about differences between allergy symptoms and COVID symptoms, and you said that fever with allergies is typically a little bit lower. How do you have like a ballpark number? Is it like of the fever number?
It's usually pretty low grade associated with allergies. Yeah, usually less than 99.
Okay. Okay, great. And I think that kind of covers most of the questions I had for you guys. Is there anything that you'd like to add that you think is super important, or something that you think people may want to know this allergy season?
I think that there's a lot of innovative new things that are out there. There are so many cool new drugs that are available for severe asthmatics who have reached that limit. They feel like they've tried everything on the planet and their asthma is still not getting better. There are a lot of new therapies for that, biological drugs. We have cutting edge new treatments for food allergies. Most little kids and some adults who have severe food allergies feel like they don't have an option except to avoid the food. And we are doing really cutting edge things for that too, desensitizing people, getting people to eat foods now, helping them through that, especially the younger they are that they start treatment. There's a possibility they may maintain long-term tolerance and be able to eat that food. And so I think that people don't realize that we have a lot of these innovative things going on, and we do a lot of research at our center as well. We recruit for studies all the time for chronic cough, for psoriasis, for eczema, for skin conditions, those kind of things. I think that people just need to know that we're here, we're open, and if they've been suffering for a long time, they don't have to. Right, Tammy?
I agree.
Well, thank you so much for talking with me and letting me do the Zoom interview with you guys. I hope you guys have a great rest of your day. And if I have any questions, is it okay if I email or call you?
Yeah, that's perfect.
Definitely.
Fantastic.